What do these guys have to do with this? If you look closely, we're talking about mental health today. That's a key piece of the equation at the county level. And I'll tell you a little bit more about these guys once we get in here. But at the surface level, if you go to National Alliance of Mental Illness, NAMI, it's a very trusted source. You'll see that you're not alone. This is what their statistics say. 1 in 5 US adults experience mental illness each year. 1 in 20 US adults experience serious mental illness each year. 1 in 6 youth aged 6 to 17 experience mental health disorder each year. 50% of lifetime mental illness begins at 14, 75% by 24, and suicide is the second leading cause of death among ages 10 through 14. Why do I bring it up, and what about these guys? It's a very complex topic. It's not a one-size-fits-all. It's very personal. It's a very meaningful space that you have to treat with kids' gloves. There's also a whole lot of state and federal mandates guiding what you cannot do. I heard an estimate the other day, about 90% of state and federal dollars spent in the space of mental health are for emergency-based services. Emergency-based. I believe that at the county level, our team's doing a great job of moving upstream to look at prevention, moving upstream to look at areas that we can address earlier and less expensively. And what do these guys represent? One of the things that we're doing at the county that I'm really proud of is moving upstream with something called communities of belonging. We discovered that even though we're the healthiest county in the state for over a decade and top 8 in the nation, that the area that we lack is personal connections. And if we just, statistically it shows, if we just have 2 authentic, healthy connections in our life, people we can lean on through loneliness or times of struggle or challenge, that our health outcomes as a community and as individuals will be exponentially better. Just having 2 authentic, healthy connections. And so communities of belonging is something that launched about 4 years ago, maybe 3.5 years ago, to recognize the epidemic of loneliness and to bring people together, people of all different backgrounds, to have a conversation about what matters in the space of mental health, what matters in our community and creating those connections. Other ideas that I'm gonna throw out, and I'm gonna invite you in the comments to suggest some things that might work for you or that have worked for you. We've had hundreds and hundreds of conversations. Last year we had our first mental health consortium in partnership with Public Health and Ridgeview Health. It was very well attended. We were intentional about inviting school districts and leaders and people from different walks of life to come. And we said, boy, that was a great first step in the right direction, but we need to continue with more conversation. But I often say one of the biggest things we can do is be in proximity. Be in proximity with people that are having challenges, because if we can help them through their moments, we're gonna have moments of our own as well. I want to elevate the sheriff's office, because once you paint the picture that mental illness and mental health is of importance, other people rally as well. And the sheriff's office, particularly Sheriff Camerud, elevated this, and now all of our sheriff's deputies and people attached to the sheriff's office once a year do something called Checkup from the Neck Up. The county pays for it, and all of the sheriff's staff are required to sit down for 30 minutes to an hour with a psychologist, and they can talk about the Vikings or the weather, or they can get into something pretty deep. And you don't have to think twice when somebody's standing up to go, or they've got their session or whatever, as to, oh, maybe that guy's got this going on, or that gal's got this going on. Everybody's doing it, so it lowers that barrier, it lowers the stigma. And I've heard anecdotally with my annual ride along with sheriff's deputies, they love it. They may be a little hesitant at first, but they love the investment in their future and different things. Also have proposed, and we're looking at the possibility of what on-ramps to summer might look like. The most vulnerable youth population period of time is within the summer. It's after you have all your programming for school. It's before you get back to school. Maybe a lot of people don't have ability to play in youth sports because sometimes they're cost prohibitive. My gosh, the cost of a bat and uniform and all those things. But I pitched the idea of, what would it look like if we had a community standard that every 2nd, 3rd, and 4th grade was urged or required, or a standard to participate in at least 3 activities a year? What does that do? It puts you in proximity with other families and creates community. It gets them on the field so that they're exercising. It creates relationships with other teammates. You get to find out a lot about different people. And when you're in proximity to people, you tend to learn more and build community and address those mental health challenges that persist. I went through, as a coach, accredited coach, some of the modules, voluntary modules of how a coach can spot different opportunities or or struggles that a kid might be dealing with. So just looking at that. And on routes to summer might look like this. It might look like a huge auditorium where people can bring their gently used equipment to make it available to somebody that may not be able to afford it. It might look like a button where you can click so you can see phone numbers and email addresses and addresses, so that if you have the ability to pick up and drop off kids, so be it. It might look like funding support or there's scholarship for kids that may not be able to afford it. If we just mowed down those 3 simple barriers, rides, equipment, and registration fees, imagine how many more kids would be on the fields. Imagine how many more kids would be participating in theater or music, and imagine how many connections would be made. I just barely touched the surface, but I wanted to say that last year the state government decided that the reimbursement rate for mental health would go down. We know that the instances of mental health are going up and they're more severe. That doesn't work. That formula doesn't work, and we know why it happens. They need to make a budget, and it's really expensive. But I believe that the best investment may be in youth. It may be preventive. It may be proactive. It may be testing and trying new things. But it certainly comes with an appetite of leaders coming together. We've got the momentum of Carver County. We want to continue the momentum. I welcome your thoughts and your ideas and your solutions and what may be working in your family, in your oikos, in your place of business, and other areas you may engage. So thanks for tuning in. I'm Matt. This is A Chat with Matt.